and quality of life. Oh, thank you. Yeah, that's important. For those with or at risk of substance use and or mental health challenges. The central focus of a ROSC is to create an infrastructure or systems of care with the resources to effectively address the full range of substance use and or mental health challenges within communities. Always want to keep that forefront. That is, it's a mouthful. It requires a lot, but it definitely requires us all. So like to make mention of that. For us, Logan Mason ROSC, our mission statement that we kind of operate from: improving access to health, wellness, and holistic recovery options for people who are at risk of or suffering from substance use disorder, while educating and connecting Logan and Mason counties to reduce stigma and improve recovery outcomes. And as you see, I intentionally highlighted reducing stigma because that is again, the topic for today and the goal that we have to talk about this topic, educate each other, and to have some conversation. So let's introduce ourselves. Today, we're just asking your name, your organization or affiliation, whatever brings you here, and what is one thing that makes your heart smile? One thing that makes your heart smile.
Okay, well, I'm Grace Irvin. I'm the prevention coordinator here at Chestnut Health Systems, overseeing the Logan Mason ROSC. I'm also a part of the Logan Mason, or no, yes, Substance Use Prevention Grant. I'm also a part of the BASE grant, and I am newly on the Livingston ROSC grant. Yeah, so that's new. What makes me smile is seeing all of you here on this meeting, seeing some new faces and seeing some faces I haven't seen in a while. So it's good to be here. So thank you all. We're going to go with Marie, then Silas, then Tyler.
Hi, I'm Marie Riley. I'm with Early Intervention at the Sangamon County Department of Public Health. We serve Sangamon, Logan, Mason, and Menard counties. And what makes my heart smile is my grandkids. And especially having one that lives with me, she makes my heart smile all the time because she's just so darn cute.
That's awesome. Thanks, Marie.
Hi, I'm Silas. I'm with Community Action Partnership Central Illinois in Lincoln. And I don't know, lots of things make me happy. So I guess just being here with you today.
Oh.
Thanks, Silas.
Hi, everyone. I'm Tyler Winger, Prevention Specialist at Chestnut Health Systems. We service Logan and Mason County. I'm working alongside Dominic Valenti. I would say what work makes my heart smile would be any time somebody does something good for somebody else. I know it's a very vague answer, but I think it's very true too.
Thanks, Tyler. I like it. All right. Tammy, then Bryson, then Dominic.
Hello, everybody. I'm Cammie Garrison. I'm with the statewide ROSC project. I'm the TA for Region 3. And what makes my heart smile is my dogs. A dork.
Awesome.
Hello, everyone. My name is Bryson McFadden. I'm an outreach worker with Orchard House, so sober living homes throughout Central Illinois. I mainly cover Sangamon, Logan, Macon, and Champaign County. Something that makes my heart smile is watching somebody come into the house early on in recovery, beaten, broken, and battered, and watch them gain control over their life again. Something I really enjoy watching. It's a big perk of my job. Thank you for having me. I'm glad to be here.
Glad to have you.
Hey guys, I'm Dominic Valenti. Tyler already kind of did a little introduction for us. So yeah, I work on the Logan Mason Substance Use Prevention Grant. I also partially on the Bloomington Normal Parents Grant that's here, Bloomington Normal. I think one of the other things that makes me my heart smile. A lot of people said some stuff. I definitely agree with Cammie. My dog makes my heart smile, but I definitely think like unconditional love. That's always a good one, or just like kindness out of random for people. Yeah.
Thanks, Don.
Oh, next, glad to have you here, Dominic. All right, next we'll have Abby, Brittany, and then Sammy.
Hey everyone. So I'm Prevent Child Abuse Illinois. Um, there's so many things that make me smile, but I guess when my husband asks if I want to go out to eat, because I love to go out to eat.
Yeah,
Yeah,
I hear that.
I love that.
like puppy chow, a large Coke, lamely like, oh my kids, my dog, whatever. Let's go out to eat. That's what I like.
Oh my God.
Wow, that's hard to follow. My name is Brittany. I am the ROSC coordinator for Macoupin and Montgomery County. I work under the umbrella of the Macoupin County Public Health Department. And gosh, there's really a lot that makes my heart smile. My two boys, I have a 2.5-year-old and a 3-month-old at home. But I will also piggyback off of what Abby said. And anytime I can get home and my husband's like, honey, don't cook. Let's go out to eat, especially if it's someplace I've never been.
Oh yeah.
That makes my fat heart smile.
Love it. And Sammy went off camera. Oh, nope, you're back.
How are you? I couldn't figure out how to get it to work. My name is Samantha. I am a person with lived experience. I am a member of the Recovery and Action Committee there with Logan Mason ROSC. And I am also a community outreach worker with Family Guidance Center. Something that makes me smile is being able to see someone's light come on in their life whenever it's been, dim or dark for so long.
Yes.
Yes.
Glad you're here.
Thanks, Brittany.
Yeah.
All right. Next, we are going to do Kara, Kristen, Carmen, and you said that was KKT is Kim.
Yeah. Did you do
Okay.
Cammy though? Did Cammy go?
Kimmy went. Yes.
Oh,
I am Kara Davis. I am the Director of Nursing at the Logan County Department of Public Health. And what makes me happy are my 3 kids. And at this point, I would say my oldest one, who's going to be 15 in a week and a half. And there's just something about her. I'm going to knock on wood because she is not the typical drama high school girl. She's one of the 4 people that I want to spend all my time with. And I told her that the other day, and she said, "Oh, mommy, I love you."
Oh,
I love it. I love it.
I love it.
I'm Kristen Davis with Family Guidance Center's Regional Substance Use Prevention Integration Center, and I'm a Prevention Integration Coordinator. And no, with our new deliverables, our titles did not get shorter. But one of the things that makes my heart smile is I'm going out to dinner with our moms group tonight, which is just a group of 7 of us that all have the same age boys that are in choir together. And it's just nice to have that support and know that you can send out a message and on anything and you'll have an answer, you'll have somebody show up, you'll whatever it is you need. So it's nice to have that community support.
That's awesome. Where are you guys
Yeah.
going out to eat now that you muted?
Oh, we're just going locally to a restaurant here in Charleston called Dirty's. Sometimes we go.
I know Dirties.
Last time we went to Rocks, Grace.
Oh, I know Rocks. That's where
Yeah,
my
you
cousin
know
works.
Rocks. Last time we went to Rocks. This time we're going to Dirty's. Sometimes we go to
Okay.
Winery. Like we just float around to different restaurants and to support our community. Because I also live in Coles County, and if you'd like to know where Coles County is, you can just Google the news. We've had some major event every day for the past week. So,
Wow.
yeah, it's been a thing. So.
Well, thanks, Kristen.
Glad you're here.
Hi, I'm Carmen Lanham. I have the same mouthful as Kristen, so I won't repeat it all for you. But yeah, it's a lovely mouthful that nothing changed. And what is it? What makes me happy?
Something that makes your heart smile.
I would say, so I've coached volleyball for middle school for about 7 years and on my second year of coaching high school ball. And I would just say, like, just seeing the girls, like, especially when they're learning something new and just seeing all the hard work that they put into practices paying off during games and just watching them have fun in practices, because sometimes I let them just go crazy. And it's just fun to see and still be so competitive, but just completely messing around. And it's fun to see it. I used to be a player myself, so it's just nice to still be in that atmosphere.
Nice. Last but not least, Kim Turner.
Kim Turner with Hope on Fifth. And I would say what makes my heart happy is when a goal is reached at Hope on Fifth or an unexpected addition happens there. And I always think of Joe Shaler.
Mm-hmm. Go Joe. Yeah.
Mm-hmm.
Awesome. Yep. Well, again am Jeanette. The one thing that I can say that many things make my heart smile, but right now, our daughter, who's 22 months old, when I say, "Where's your teeth?" she says, "Cheese," and that completely, utterly melts my heart, totally. And then we have
Danny. I'm a community health worker for SOU Family Medicine in Lincoln. And what makes my heart smile? Of course, my kids, but in particular, my 18-year-old, watching her kind of making steps recently towards adulthood makes me a very proud mama. So,
yeah. Hey, well, good deal. Well, thank you for sharing a bit of yourselves. We do believe strongly that the stronger we build our relationship, the further our work goes. So thank you for entertaining me and letting us learn some stuff about each other. As you all know, I like to pull out a quote, and we're going to be talking about stigma, and that's what this quote is really in reference to. We should make it clear that getting help isn't a sign of weakness, it's a sign of strength. Our world has told us that when we don't have it all together, when we don't have the answer, we're less than or we're lacking. And this falls very much into the stigma of substance use disorder and mental health issues as a whole. So just a little something to think about as we move forward through our presentation today. We're going to go over some information. If I ever am going too fast of this, because we do go over this stuff every time intentionally, please slow me down, or if you have any other questions. But we do want to make sure that everyone is aware that we have the Logan Mason County Recovery Meeting cards available. This comes in a 5x7 or a business card size. So if this is something, or we can, I did include it in the email, so you can have a digital copy as well. You can help pass that along. It really goes a long way for people to be aware of how many meetings we actually have and where they are. So thank you for helping to share that. We want to make mention again, community service alerts is the Logan Mason websites that have been created. So logancountyresources.org and masoncountyresources.org, both very comprehensive websites. If we don't have your information there, please share it with us so we can get it on. If you need any updates or things like that, please let us know. Or if you see something that we're missing, please share that with us so we can get that on there. But we're just trying to make it as easy as possible, right, to find the resources we need. I want to make mention of the Smart Recovery meeting, and that's because this is the only meeting within a Smart Recovery meeting in person that we are aware of within 30 miles of each other. So want to make sure that this is an evidence-based program. It's not just for those dealing with substance use disorder, but any behavior or that's interfering with you living your best life. So feel free to send anyone our way. Fridays from noon to 1:30, and we do meet at Hope on Fifth. We do want to make mention of the women's meetings We have a brand new meeting that started at Trillium Place, 9 a.m. It's a peer support group for ladies. I'm trying to find my mouse and it's on the wrong one. And also the 12-step meeting, a woman's way through the 12-step meeting is still happening on Sunday from 1 to 3:30. Again, at Hope on Fifth. I'm gonna make sure you all are aware. Yeah. We also want to make mention is the meetings in Mason County. There are two currently, both in Havana, one on Wednesday night at 6 p.m. and the newest meeting that started on Fridays at 6 p.m. So please help to get the word out. One of the ways that we know that we strengthen meetings is by sharing so that we can help support other folks' meetings. So even if you are in a different county, maybe you have a different ROSC, it helps to share these different meetings. Sometimes people would like to get on the road and go to a meeting they've never been to. So just want to make sure you all are aware. All right, our Logan County harm reduction resources. This is where we can find naloxone and testing strips, fentanyl, xylazine, and benzyl testing strips. So at the Family Custom Cleaners, Logan County Health Department, Mount Pulaski Library, and the Logan County Courthouse. Also in Logan County, next is at Hope on Fifth, and the Logan County Jail lobby also. I wanted to pause, well, we'll go through the next ones. And so these are the ones in Logan County. Also in Mason County here at the, Havana Public Library, the Mason County Health Department, the Foreman Valley Public Library, and also here at the Mason City Public Library. This is where I wanted to pause and ask, is there a place, a business, a location that you all could suggest that maybe we explore and see if they're interested in having harm reduction resources there? I don't know that I've ever paused to ask. We kind of share where we've gotten things, but I'm looking for some suggestions. Is there anywhere that someone would suggest that we connect with? Silas, do you know if Community Action has harm reduction resources available there?
I don't believe that we do, but I can ask the people that should know. I mean, everybody should know, but let me see if we can get some here.
I love that. And if not, maybe we can meet and talk about to see if that's an option, because I think that's definitely a place that makes sense to consider.
Yeah.
Yeah. Thank you. Anybody else? Any suggestions? All right. Well, if you think of any in the future, please don't hesitate to throw it out there. We want to continue to increase the availability. All right. So, food pantry. Okay, I see you. That's a good idea. Thank you. All right, so we're going to get into the meat of our topic today, and this is stigma. The reason, as you see from our strategic plan, our goal 3, increase awareness around recovery and reduce stigma. So this is the intent. Our local laundromat. Okay, Brittany, thank you. Thank you. We do have, that's actually where we have placed our vending machine is actually at the local Family Custom Cleaners, which is a 24-hour laundromat. So yes, thank you. Thank you for that. Good stuff. So we are intentionally following through with, our strategic plan. What is stigma? We hear the word, we throw it around, we hear it all the time, but words are very powerful. A mark of disgrace associated with a particular circumstance, quality, or person. That's strong. I mean, think about that. set of negative or unfair beliefs that a society or a group of people have about something. I was telling Grace, even on the way here, I was listening to a podcast, and they were describing where this word stigma actually originated from. And stigma was actually a mark that they would physically put on someone's skin or body to mark them as have been a lawbreaker or immoral of some kind. So just be thinking about how strong that is and how important that we really try to educate ourselves, and while doing this work, really finding commitment on how to be a champion on helping to chip away at that stigma, because all of us have the ability to affect and influence the stigma around us. So we are going to watch a clip.
Overcoming a substance use disorder is no easy task, especially when society stigmatizes the disorder. Destigmatizing drug use and addiction is critical to supporting your friends and loved ones on their path to recovery.
People feel really alone when they have substance use disorders, but they're quite common. Substance use disorders sort of transect every subpopulation or subset of society. You can be Black, white, you can be rich, you can be poor. Everyone at every level of society is affected by substance use disorders.
One of the biggest issues for people who have substance use disorders is being able to get treatment and being able to feel comfortable coming forward and saying that they have a problem with this.
When I was addicted to substances, I kept it to myself. I didn't share it with anyone because I was embarrassed. I had guilt, shame, remorse. I was a public figure. I was known by a lot of people, so I tried to hide my addiction.
There's been long-standing stigma around substance use disorders, which has contributed to addiction and substance use disorders not really being recognized as a chronic disease, but it is. It changes the brain and changes the body much in the same way or in similar ways that we see with other chronic diseases like heart disease or diabetes.
I've never heard anyone say that they feel badly about having asthma and taking their inhaler. But I always feel like I hear lots of people saying that they actually feel really badly about having to take an antidepressant or having to go and get treatment for substance use. And there's so much shame associated with it. One of the most important things that families and friends can do for people who have this issue is showing compassion and showing empathy.
A lot of the stigma around substance use disorder is linked to the language that traditionally we've used to describe substance use disorders and the people that have substance use disorders.
Words matter. It's important to avoid words and phrases that can create negative stigma. Being thoughtful about how we refer to substance use disorders can increase the likelihood that a person will seek help and treatment. Even medical professionals, family members, and friends can use language or interact with people with substance use disorders in a way that can discourage them from getting treatment.
When people are met with judgment or contempt, that may make people less likely to seek treatment longer term. So we want people to have a sense that they're cared for and that we have compassion, empathy, and curiosity about their experience.
Because of feelings of guilt and shame, individuals with a substance use disorder may also be hesitant to reach out to their family, friends, pastor, or other trusted individuals.
People can feel very isolated. They can feel ashamed and like they can't talk to other friends about what's going on. It often is really hard for families initially to get their head around the fact that this is an illness, right? Because there's so much stigma in our society.
Organizations such as Alcoholics Anonymous and Narcotics Anonymous can provide a safe place to seek help. They can also be a place for family members who have loved ones with substance use disorders to connect with others who are going through a similar situation.
The reason why they're called anonymous is because what is said there is supposed to stay there. And so it's a place where everybody is struggling with the same thing. So whether it's that people are trying not to use substances, or if it's people have a family member who's using substances. And so it's kind of a safe space where people can talk with other people who have similar struggles.
For more information about stimulant use disorders and resources for support and recovery, visit empoweredtoserve.org/stimulant use disorder.
Go.
Well, I'm certain that it's things that we have heard before, but I wanted to bring up, this field is changing so rapidly, right? Our words, the more that we understand person-centered or person-first language, even when you think of SAMHSA, right? Our national leaders, right? Substance abuse, mental health. Those are what the letters stand for, right? The A in SAMHSA is abuse, which we already know, even in literature they put out, is that a word that we no longer want to continue to use. This is how rapidly these things are changing and how we are getting information that can help us understand this better. So breaking down stigma. One way to break down the stigma is impacting people is to understand substance use disorder as a brain disease. This can help reduce stigma in several critical ways. One is it shifts the narrative from personal blame to a medical understanding, recognizing that substance use disorder involves biological changes and are not a matter of willpower. This is one where we have the evidence now that when medical officials speak regarding those struggling with substance use disorder in medical terms, they do see that they get better care and receive more respect even in the process of receiving care. Two, it places substance use disorder in the same category as other chronic medical conditions that benefit from ongoing management and support. So as the woman said in the video, I've never seen anyone feel bad about having to take their inhaler for their asthma. How can we begin to chip away at the stigma that's attached to those struggling with substance use disorder while they're to get help? Three, to emphasize the importance of evidence-based treatment approaches rather than punishment or moral judgment. How do we move from, the kind where we're trying to arrest the addiction out of folks? That is very difficult. How can we move into the places where we can add more SMART recovery meetings or more cognitive behavioral therapy classes or those kind of things. And four, it supports the role of all healthcare practitioners in screening for the treating substance use disorder rather than viewing people who have substance use disorder as having primarily legal and moral issues. Right? We think that that's the thing. We have to remember that active addiction is simply the manifestation of the broken places, right? It is not the addiction, or excuse me, it's not the being active addiction and the using that is necessarily the absolute end all problem. The problem is dealing and addressing the traumas and things that have us move into that place of active addiction. We have, if we can go next, recent research has shown that when healthcare providers receive education about the neurobiology of addiction, their attitudes towards patients who have substance use disorders improve significantly. The scientific understanding helps replace stigmatizing beliefs with empathy and evidence-based approaches to treatment. However, addressing stigma requires a multifaceted approach beyond just education about the brain disease model. So we know this is just one component. This is this is multifaceted for sure. But another great way, and what is highlighted and what I want us all to consider, one of the most powerful tools in reducing stigma is direct interaction with people in recovery. Through peer support programs in recovery, storytelling, healthcare providers, community members, and policy makers gain firsthand exposure to the human reality of substance use disorder. These personal connections challenge stereotypes and misconceptions, replacing them with understanding and empathy. If we can we see each other for a little while, Grace, before we move on to that next slide? I just like to have a bit of a conversation. how do folks feel about stigma? And well, let me ask this is what I really want to answer. Have you or has anyone here had their perception changed because they had an interaction with someone personally? Anyone here?
Well, mine has changed every single day since I started this job. Because before I started this job, I thought I was really open-minded and empathetic, but I just had a lack of understanding about substance use disorder. So I've learned every day from every single person that I work with all the time and come in contact with. And for me to, humbly say that, I thought I was really open-minded up until 2 years ago, and I didn't know squat.
I love that, Tammy. Thanks for being honest. I'm actually going to keep putting you on the spot for a second. Can you think of one thing that you learned that you were like, wow, I didn't realize that. That was maybe a faulty thinking when it comes to substance use disorder.
Mm-hmm. I guess I thought that people that abuse drugs and alcohol, it's because they come from traumas and they're always trying to drink away or drug away traumas in their life. So I guess now I realize that that's not the case, and that, looking at it as the clinical model, that just it can happen to anybody. And oftentimes it doesn't stem from a place of trauma. So I would say that's probably one of my biggest misunderstandings about it.
Mm-hmm. Thank you for sharing. Yeah, we've heard that sometimes, like you chose to use, so stop, right? But what we don't understand is that many of us suffer from addiction before we ever get a substance in us. It is when that first substance gets in us that something is awakened, right? That may not be awakened from anyone else on our block, but and we never know who has that, who that will happen to. So absolutely, thank you for sharing. Anybody else? Something that you learned about in recovery? Yeah, Marie?
I found a better understanding of my dad. He literally drank himself to death. And I never understood. I really never did. I suffered a lot of trauma because of that. Because, he deserted his family. I never understood until I actually went through a like a mental health substance misuse training that showed me how closely that they're related, because I've had mental health issues, depression, and like emotional eating, and I'm a people pleaser. I've had all of the relationship addiction, and how closely they're related, and how your brain changes. And it was just amazing to me that the reaction in your brain is the same. And it gave me such a better understanding, and it really did help me reduce that stigma, because I was always so careful. I was scared to death, like as a teenager, that if I, had that drink with my friends or whatever, who were all partying back then, that I was just going to become an alcoholic. So I was so careful about that. But yet I had my own little things that I became dependent on, which was, becoming that people pleaser and putting everything that I was into a relationship, like I did not exist outside of that. I had no clue who I was as a person unless I was with someone. And it took me years to, to deal with that. And the trauma that I went through because of substance misuse I perpetrated onto my children through my addictions, which were not substance related, but they act in the same manner. And I really think that helped me go a long way toward the reducing my feelings about stigma, and then meeting people who, like through Celebrate Recovery that I went through, because it's kind of for everything. Meeting people and then working through the foster care system where I met these parents who were, they were good people who made mistakes, and those mistakes changed their brains, and who otherwise were really good people and really great parents, but who couldn't stay sober because they were fighting their own brains and the chemicals and the changes that had made. And it wasn't that they didn't love their kids enough. It had nothing to do with that. So all that worked toward changing my perspectives. So
Thank you. Thank you, Marie. Brittany.
Yeah, so I am not ashamed to admit that I came into my position at the health department. I started off as a front desk assistant, but I came into that position with a lot of biases, because I grew up in a household of substance use and mental health disorders. And way back in the late 80s and early 90s, they didn't have the resources then that they do today for mental health and substance use. And so, it wasn't uncommon for my parents to self-medicate for their disorders. And so, you hold a grudge, and you hold a lot of just feelings for that in general for a long time. And I think when I started that position in the front desk, I got to see people's journeys with recovery and got to know them as people. And I got to realize that I had like tunnel vision on what recovery and mental health looks like. And so seeing these people that, they're real people, taking them out of that mind frame of, this is your fault, you had a choice, and things like that. It's really opened my eyes. And so then when the position with the ROSC came open, I knew that that's something that I wanted to be a part of, to specifically help with those resources, but to also help with the youth of today that might also be going through those same scenarios, to make sure that their parents get the resources and help that they need.
Thank you for the honesty. It's hard to admit, hey, I have to say that before I didn't struggle with substances till later in my life. And I served people, I worked for the community, and I used to think, just stop. I didn't get it until the first time I used without my own permission. I will never forget that. You could have put me on a lie detector test, me saying I'll never, ever, never, ever, and I believed it with my whole heart. And then looking up to see using without my own permission, it's an awakening, definitely. Grace, I saw your hand up.
Sammy, you can go first.
Oh, Sammy, yes.
I was just gonna say that, like, so I allowed the stigma to affect the way that I felt about myself, during my active addiction. And it wasn't until I got clean and, actually stayed clean for a little while and then, started working in the recovery community and things of that nature that I did realize that, I wasn't all of those things that the that like everyone was saying. I'm not once a junkie, always a junkie. I'm not just a horrible person because I made some mistakes. I just wanted to say that I allowed stigma to affect the way that I felt about myself until I got the education and actually learned myself.
Yeah. Thank you, Sammy. 100% understand that for sure.
Yeah. I think one of the things about like that has opened my eyes being in the position I'm in is learning that recovery looks different to everybody, right? And so like growing up and things you're always taught like abstinence, like you have to be totally abstinent from all substances, right? But that doesn't work for everybody. Some people, might have, issues with heroin, but they might not have issues with alcohol or pot or something. Like it just differentiates between people. But like that this job has really opened my eyes to that like, you know, recovery, there's multiple pathways to it. Which I think is really cool.
Well, thank you. Thank you for everyone that shared and even just shared a personal piece of yourself. I think, again, this is all of our responsibility, right? To use our circle of influence to chip away at these thoughts and ideas. And sometimes, as Sammy was saying, allowed stigma to think about I mean, that's what I fight constantly, right? To not think less of myself. That's what I have to fight constantly, that I'm not less than or too much. That we are not, our disease, that we are not our addiction, we're not the mistakes that we made. But what we find when should we not change that language and that way of sharing about active addiction, it becomes a self-fulfilling prophecy, right? Because we're hearing it, we're thinking we're less than no matter what, and no matter what we do, we'll never be okay. And we have systems, right, that are set up, unfortunately, to that create barriers. One of those, for instance, I was working with a mom whom made the conscious choice to go out of state to treatment. Spent about 5 months in intense treatment and was very responsible. Before she left, she made the decision to sign her son's rights over to her mom so that he can care for them. Upon her return and successful, getting back, got a job and whatnot, now because she went away for treatment is one of the reasons why they're using that she's not ready to have her rights back from her child. So you see how, sometimes that those things can backfire, that we're seeking help, but then the help that we seek can be the thing that keeps us right from our next goal. That's even with when we talk about leaving institutions or treatment centers, depending on our records, our backgrounds, it affects if we can get a job, it affects if we can get housing, it affects, if we can get public assistance sometimes, depending on what our charges are. So it's these things that are very much affected. And I just felt it's important enough for us to pause and just really intently think about these things. And really what I hope that folks will do is walk away making a commitment to yourself, one thing that you could do to help chip away at stigma, and sometimes for me that looks like speaking to someone whom I know is an active addiction, just to sit down and talk with them. Sometimes it is just to correct somebody when I hear someone say something incorrect about someone, or even to advocate for someone who may be being talked down about, like at work, in a work setting place, right, or a public setting place where folks are really talking down about. Do we have the courage to step up and say, hey, yeah, that's, I know a little something about that, and share a little something there. I think that those are all opportunities that we have to be an active person chipping away at the stigma that's attached to this. Another way that we are going to be really wanting to partner with you all is our anti-stigma campaign. As you all know, and you saw a brief before the end of the year last year, we kicked it off originally and kind of had to put it to the side, grants and whatnot being written, and so here we are back, and we want to partner. Our campaign is reframing recovery, and we're going to do that in multiple ways by pointing out words that matter, different things that words that we could use, positive statistics that we want to put out, and also just embracing self-worth and different ideas and ways that we can help encourage folks to how we think about ourselves. So these are just a snapshot of some. We have several more. What we're preparing is we're putting boxes together of all of our posters and ways that we can share it in the community. And our hope is that then I will be visiting you, and maybe your organization, agency, a business that you could think of would be willing to help share some of these things in their in offices and in different businesses. And so we will talk more about what that will continue to look like, but I just want you to be on the lookout. Again, I think strongly this is each one of our responsibility to where we could make a difference here. So any questions or last comments about stigma before we move on? I swear this is the fastest hour of my entire month. It just goes by like water. I just don't get enough time with y'all. Well, thank you for, again, those who are sharing. So some upcoming opportunities. What's happening? Our bridge, right? Our deflection program implementation planning continues. The next meeting won't be until August 12th, 1 to 2:30, and that'll be at the Logan County Health Department. I believe everyone here is familiar with Bridge and our initiative that we're pushing. If not, please specifically reach out so we can chat about it, because I'd love to tell you all the deets. Some community events that are coming up. Third Friday is tomorrow. We'll be there from 5:30 to 8:30. And the next Friday, August 1st, is Havana First Fridays. So we will be in Havana on August 1st. What's next? Saturday, this Saturday, there's an AA speaker meeting at the Land of Lincoln group that does meet at Hope on Fifth. This is a great opportunity, any of these events coming up. If you've never seen or heard someone share their recovery story, it's a really great time to come out. So that's happening on July 19th, this Saturday. And then our Breaking Barriers event that's happening Saturday, August 9th. This is our partnership with Chief Meister and the Lincoln Police Department. They were co-hosting this event. Hope on Fifth, we will be there in the grassy area. The officers are going to be grilling up the hot dogs and hamburgers. We'll be playing games, music, but even more than that, we will be hearing from speakers, and that includes Chief Meister will be sharing about his vision as well for what's taking place. So we hope that you can join us for those things. Save the date. Overdose Awareness Day is August 31st. It does land on a Sunday. We will be doing a live panel of folks whom naloxone has saved their life, or harm reduction resources has saved their life. So we did get the okay from Hope on Fifth. So we are going to have not just the Facebook Live, but we're also going to do a live audience for the first time. And so more details will come. And then it is that time of year, our recovery walks. September is Recovery Month. And so our recovery walk for Mason County is in Havana on the September 20th from noon to 3 at the Riverfront Park. And then in Lincoln on September 27th, we will be at Scully Park, again from noon to 3. With the minutes and that I sent out this morning with the reminder, also there is a link to sign up if you would like to join us with resource tables, or if you would like us to share information. Maybe you can't come, we would love to share information on your behalf. But that sign up genius is part of the email that was sent out with the reminder. We'll send it out again with some of the posters that we'll be sending out for the anti-stigma campaign posters. Any questions about any of those events? Okie dokie. Want to make sure that you know that our Recovery in Action Committee meets the second Tuesday of every month. In August, that will land on August 12th. We meet from 4:30 to 6. Man, this is where we do a lot of our planning. This is also, we need to create more bags, resource bags that our sheriff at the jail is willing to hand out to folks. And these are things that we do within this group, coming up with different ways to educate our community. So if you love planning, if you are trying to figure a way to give back, or if you work with someone who is trying to find ways on how to serve, please send them our way. We'd love for them to join us. Our next ROSC meeting lands on the third Thursday of each month, which is August 21st, 2 p.m. And we will be at Hope on 5th or by Zoom. So whatever is most convenient for you. That is all that I have. I do want to leave a minute or two for any highlights, updates, questions, things you would like to share with us. Please do. Bryson, is there any openings at the Oxford House right now?
Yes, I believe they have 2 openings at the house in Lincoln. And I still got some beds open in Decatur as well.
Okay. All right, folks. So you heard it. So the Oxford House in Lincoln, 2 openings, and men's Oxford House in Decatur. So 2 opportunities to connect people with great housing opportunities. Yes. Okay.
Abby just dropped this in the chat. These are upcoming events, some different trainings. August 19th, Drug and Danger Children Awareness via Zoom, 11:30 to 1. September 6th, 11:30 to 3:30, Downtown Springfield Family Fun Festival. September 9th, 11:30 to 1, Drug and Danger Children Moving from Awareness to Action. Also in Zoom. September 25th, Safe Sleep for Babies via Zoom. October 23rd, 31st, Prevent Child Abuse, Illinois Statewide Conference in Naperville. If you want more information, reach out to Abby.
Thank you for sharing, Abby. Anything else?
Yeah, I've got something.
Yeah, Danny.
Shortly before I got here, actually, my supervisor forwarded me some information that SIU is hosting an addiction medicine conference in September. So if anybody would like the information, I can pass that along to all of you. And it's September 24th at the Memorial Learning Center in Springfield. So
awesome. Thank you for that. And when you were saying that, there was one more thing I thought I was going to say. Doggone it. Oh, it's going to drive me batty. It was something. It was like right there, like, oh yeah, and then gone. Oh well. Anywho, thank you. Thank you for being with us. I hope that, my hope is always that you walk away with something, just a little bit different than when we came. Maybe it's learning something new, hearing something different, something to ponder and consider. And look, we might not all agree. We are not confused that not everyone believes in the disease model. Let's talk about it. How do we talk to people in recovery if we don't believe that? This is where, I want to be able to start having those real conversations and let this be a safe place to explore those things. But thank you for your attention and for continuing to walk alongside us, and hope to see you sooner than later. Thank you all.
Bye, everyone. Thank you.